Now I would like to invite Dr. Divya Balakrishnan for our video simplifying complex diabetic retinal detachments.
At the outset, I would like to thank KSOS for giving me this opportunity. So I'll be playing the video. Diabetic retinal detachments are always challenging even for expert VR surgeons. This video demonstrates a step-by-step approach to these difficult cases so as to simplify it. The important step in diabetic vitrectomy is to release the traction by identifying the right plane of posterior hyaloid and the right plane for membrane dissection. After core vitrectomy, the first step is to release the anteroposterior traction by doing truncation, that is to separate the vitreous base from posterior. Small gauge vitrectomy cutter may be used to separate the posterior hyaloid by sweeping action by placing the cutter below the posterior hyaloid. Sometimes the dissection may have to be started inside out from the disc, especially in cases where the peripheral posterior hyaloid is very adherent. The fibrovascular polyp over the disc may be released using the forceps, and the cutter may be used to delaminate it by the rollback method. Cutter is being used like scissors for segmentation by lift and cut method. Use of suction to engage the membrane in the port for cutting. Subhyaloid hemorrhage may be removed by using cutter, vacuum, or by the reflex method. In this case of combined retinal detachment, all-prop vitrectomy method is done where the cutter is used to do segmentation and to delaminate the membrane. Diathermy is used to make retinotomy, and a fluid-fluid exchange is done in these cases of combined or tractional retinal detachment as the subretinal fluid will be thick. Look for second membrane around the center of a fibrovascular proliferation. It's important to identify this to get the right plane for dissection. A bimanual dissection using forceps and scissors is done here. Cutter is being used to create a plane by lift and shape method. A combination of outside in and inside out method is being used here. In this case of posterior closed funnel retinal detachment, the dissection is initiated from the disc in an inside-out manner. A bimanual dissection is being done here. A meticulous step-by-step dissection using appropriate instrument and technique leads to a successful outcome in these difficult cases.
Excellent video, Dr. Divya. So the membrane peelings. Now, what I wanted to ask is what your preference of gauge in cutting such sort of membranes is. Do you still use 23 gauge, or do you have you completely shifted to 25 gauge?
Because of late, 10,000 cutters, because that has got a bevel edge, so that has an add. So of late I use 25 gauge 10,000 cutters because that has got a bevel edge, which actually helps in many cases. You do not use for scissors actually.
So, Dr. Divya, very nice video, and Piyush is the right person to comment on the scientific and technical aspect. What I would like to ask is, what do you wish to, give a take-home message from your videos? It is difficult in diabetic retinopathy, and the use of instrumentation, techniques, skills, patience, everything is very important. But what is the take-home message you are wanting to give to us from this video?
See, it's a combination of techniques which we have to use when you deal with these cases of diabetic retinopathy, and a pre-op good assessment actually, where in some cases you may have to plan for a bimanual dissection. Yeah. So don't have a fixed idea that I'll go for only a 3-gauge, 3 ports vitrectomy. But as you see that the situation becomes difficult, you may have to switch from a 3-port to a 4-port, and then you may have to go for a bimanual dissection. So it's not like a single technique which you should be using, but it's a combination of technique depending upon the difficulty of the cases.
Right. So Dr. Divya, again, speaking from the perspective of AIOS, I wish this video goes into the finals and wins an award. So, but for that to happen, you have to, in that 8 minutes of your video, you have to say, step 1, this is where I did differently. Step 2, you have to be cautious, do it this way, and conventional steps might not be. And step 3, and at the end, they take home messages of the video. So, I mean, these are again very, very suggestions for you to, make it even better video than what it is now.
Thank you so much, sir, for that.